Hi everyone. This video will introduce you to the different specifics that underlie the development of gross and fine motor movements. To guide you in absorbing the information provided by this video, I encourage you to think of the following questions. First, what are gross motor movements and what are the underlying mechanics that allow for them to happen? More specifically, what are the foundations that infants need in order to learn how to walk? Second, what are the important motor development milestones and what are some of the contributors to its accomplishment? Third, what are fine motor skills and how is this illustrated by grasping, one of the most studied fine motor skill? And fourth, what is the nature of grasping at infancy and how does a child assimilate which kind of grasp is appropriate for a given task? Starting with gross motor movements, as we have mentioned in our module, gross motor movements involve large muscle activities such as moving one's arm, walking, and kicking. One of the most studied gross motor movements is locomotion or walking. Learning to walk has its underpinnings in the development of posture. The ability to walk depends on the ability of the infant to balance on one leg as the other is swung forward and to shift weight from one leg to another. Interestingly enough, even before the ability to walk, infants already have the ability to make alternating movements with their leg, even at the time of during the fetal period, as seen in the baby kicking in the womb. But then we have to ask, if the ability to alternately move the legs is already there, why does it take a while to happen? The key skill in learning to walk appears to be stabilizing balance on one leg long enough to swing the other forward and shift the weight without falling. This is a difficult biomechanical problem, and it takes an infant about a year to do it. In learning to walk, given the mobility and the freedom it gives the child, the infant also learns about the kinds of places and surfaces that are safe for walking. Through the aid of experience, infants are able to distinguish what angles or steepness of slopes are safe to walk on, what steps might also be too difficult to take on. Experience is a very important teacher even at the young ages of being a baby. For example, an inexperienced baby may just go down steep slopes regardless of how steep that it is, and learn the difficult way of falling down or tumbling over in the process. From that experience, they'll learn to judge similar slopes or the same slope on how to better approach them because of their past experience. In relation to walking, experience and practice are very important markers for learning. A child learning how to walk will continuously gain confidence in their ability to walk and smoothen their movements through repetitive practice and understanding of their own experiences. Other than practice, learning to walk also includes the assimilation or understanding of their environment through their senses. So the perception of the infant of their environment will give them information on how safe an environment is for them to go to. They may be judging the narrowness of a walkway or if they are able to hold on to something as they explore and walk. Motor development also has important milestones which are aimed to be achieved by around the first year of life. It is well understood that typically an infant does not just directly get up and start walking. There are several milestones that are usually met before the ability to walk alone is present, and we'll go through these developmental milestones. So the first is staying prone or on their belly and the ability to lift their head, which is seen at around less than 1 month. The second is still prone with the ability to lift their chest up with the support of their arms from around 2 to 4 months. The third is the ability to roll over at around 2 to 5 months. The fourth milestone is supporting one's weight with their legs. So that's around 3 to 6 months. And then the fifth is sitting without support. And that's around 4 months to 8 months. And the sixth is standing with support, which is around 5 months to 10 months, followed by pulling up to stand, so 6 to 10 months, and then walking with support, so 7 to 13 months, and standing alone easily from around 10 to 14 months. And lastly, at around 11 to 14 months, they'll be able to walk alone already with much ease. So although these are estimates and timings for these milestones, especially the later ones, there may still be variations in where they can be seen. And an important contributor to seeing these accomplishments is the abundance of experience and practice the child gets, coupled with a safe and motivating environment that allows for exploration. So moving on to fine motor skills, these are the movements that are finely tuned, which require finger dexterity. One of the most studied fine motor skills of infants is that of grasping, which comes in two forms. So the first is the palmar grasp, which is first seen and involves grasping things with their whole hand. And the second type of grasping is the pincer grasp, which is typically seen towards the end of the first year of life and involves grasping small items with their thumb and forefinger. So infants at that young of an age already possess the ability to adjust their grasp based on what they are going to hold. And the nature of fine motor skills, more specifically in grasping, is that of a system that is flexible and able to adapt based on the object's size, the object's shape and texture, as well as the relative size of the object to the infant's hand. So now asking the question, what allows the assimilation of which grasp they use? And the answer to this is perceptual motor coupling. And this is a necessary ability that allows an infant to coordinate their fine motor skills of grasping with the use of information from looking at the characteristics of the object and feeling the object. So when a child is able to perceive an object, like picking up a button, they will accommodate and adapt their grasp to effectively pick up the button. So here are some further examples, okay? So a child picking up a snack, so as we can see in this example, there's small pieces of cereal, they'll tend to use the pincer grasp to pick up something small. The second example we have is an infant who will tend to hold their bottle with two hands, since these things don't necessarily fit comfortably with just one hand. So they use a palmar grasp using both hands to hold something as big as their bottle. And lastly, near the bottom of the page, we can see a small toy that has a handle. And an infant, upon seeing it and holding it, will realize that holding it with a palmar grasp is the most effective way of holding it. So in summary, this video introduces the important gross and fine motor skills that infants have been mostly seen to use. Through their understanding of their environment and practice, they are able to continue to learn and stay motivated to move and explore, not only with the use of their senses, but also with the use of their bodily movements.